All right, everyone, we're going to get started. My name is John Morris, and I have the honor of being the director of the Knight Alzheimer's Disease Research Center here at Washington University. And we're delighted to welcome everyone to the 9th Norman R. Seay Lecture. Just a few housekeeping tasks. If you have your smartphone, will you put it on vibrate or turn it off? If people need to use restrooms, if you would just go outside the door and turn that way, they'll be right there. And I think that's it. There may be more housekeeping details, but if I think about them, I'll pop back up here. I'd like now to invite Adrian Davis, who is the William Van Cleve Professor at Law at Washington University and also Vice Provost at Washington University, to have some opening remarks for all of us on the occasion of this 9th Seay Lecture. Adrian, please welcome Dr. Davis.
Thank you, Dr. Morris. On behalf of Washington University, I would like to welcome you all here to the 9th Annual Norman R. Seay Lecture. 2 years ago, at the 7th Norman R. Seay Lecture, I had the distinct honor of introducing Norman Seay as what I called civil rights royalty. And I shared that I had met Margaret Bush Wilson, who has since left us, who had introduced me to Mr. Seay, and that this introduction to one of my civil rights heroes was a formative moment in my moving to St. Louis, and learning of Mr. Say's distinct history of what we call servant leadership, or those who live their lives in the service of social justice, racial and economic equality, and human rights, so that the country can really finally live up to its democratic, egalitarian potential. The Norman R. Seay Lecture, sponsored by the Charles F. and Joanne Knight Alzheimer Disease Research Center, is, I think, where civil rights history meets the civil rights future. Today, we are in desperate need of civil rights in St. Louis more than ever. I have begun to refer to Ferguson as Ferguson with a capital F and Ferguson with a small f. Ferguson with a capital F is the crisis of justice that continues to unfold around us. And by Ferguson with a small f, I mean how our region has become symptomatic of crises that plague urban communities around the country. Public health and health disparities are a crucial part of that crisis. Many diseases remain underdiagnosed and undertreated in Black and other vulnerable populations, including Alzheimer's disease. As my health colleagues at Washington University, including Dr. Morris, have taught me, addressing health disparities is as crucial to political stability and human flourishing and human rights as is the right to vote or the ability to earn a living. Without our health and without access to healthcare research and healthcare innovations, we will die and never be able to meaningfully exercise our hard-fought political rights. Part of the story of racism in the United States is the exclusion of African Americans from access to equal health care and research. We must all work to end that exclusion and to educate others to understand that ending health disparities, particularly ones that remain hard for us to understand, like Alzheimer's disease, is part of the work of the human rights future. I want to thank my colleagues, Dr. John Morris, Director of the Alzheimer's Disease Research Center at Washington University, and also Andre Denny, and Murtis Spencer, two indispensable members of Dr. Morris's team who introduced me to the wonderful work that the Alzheimer's Disease Research Center continues to do. I would also like to thank my sisters in the Links Incorporated St. Louis chapter, and especially our president, Mary Harper Thomas, and our health chair, Arlene Moore, for their annual co-sponsorship of the Norman R. Seay Lecture. Joining the struggle for health as a civil right is one of the Link's priorities. And finally, I want to thank Mr. Seay, whose life has modeled a vision of civil rights, equality, and access for all Americans. Thank you and welcome.
Adrian, thank you so much for those very compelling remarks. I want to just recount how the Seay lecture came to be. 2001, it became apparent to us in the Knight Alzheimer's Disease Research Center that our research volunteers, who are the bread and butter of what we do, allowing us to evaluate their memory and thinking over a period of many years, was almost exclusively Caucasian, and we were not a very welcoming and certainly not a very diverse program. So I turned to Norman and asked him to help form an African American advisory board to help us become more welcoming and inclusive. And Norman was the inaugural chair of that African American advisory board. And it has been a remarkable resource for all of us, and we've come very much to treasure their input, their advice, and their support. And I would like to ask, in addition to Ida Goodwin-Woolfolk, who now is the chair of the African American Advisory Board, all members of the board who are here today, if you would just stand up and let us thank you very much for your service. So when Mr. Seay decided to step down as chair of the African American Advisory Board, he remains a very vital member of the board. We decided to organize the annual lecture in honor of Mr. Seay. I still believe that it is the only School of Medicine lecture that is named for an African American. Now, some people would say that there is a Homer Phillips lecture, and there is, but I think that's named more for the institution than the person for whom it is called. So this is a very special lecture for us, and we've had very special lecturers who have enhanced it, and it gives me great pleasure to introduce the 9th Seay lecturer. It's Dr. Goldie S. Byrd. She is Dean of the College of Arts and Sciences at North Carolina Agricultural and Technical State University in Greensboro. She also is the Nathan F. Sims Distinguished Professor of Biology, and she's Adjunct Professor of Genetics at Duke University. Dr. Sims did her undergraduate work at North Carolina A&T State University with Bachelor of Science degrees in both biology and in secondary education. Then she and her husband moved to Meharry, where she received her doctoral degree in microbial genetics and physiology. She was telling me that because, in part, of some family members who had Alzheimer's disease, but more because she wanted to move in from microbial genetics into human genetics, she took a sabbatical about 11 years ago at Duke University in genetics with a renowned Alzheimer geneticist, Margaret Parachek Vance, and she became very aware, Dr. Byrd, that there was little outreach to include African Americans in genetic studies, much less research studies in Alzheimer's disease, so she has had this as a major facet of her career ever since. She also is highly sought after for her many gifts, including making research teams very effective, and also in attracting and mentoring students in STEM, science, technology, engineering, and mathematics. And in 2010, she was invited to the White House and received the Presidential Award for Excellence in STEM mentoring. So it gives me great pleasure, and I would like you all to join me in inviting Dr. Byrd to be our 9th Seay lecturer. Norman, we're going to take, photo break. So you get this gorgeous plaque. You get the same between Norman and myself. Should we move over there? Would that be better?
Yeah.
Good afternoon. I want to thank John for the invitation to come. It's such a pleasure to always talk about what we are trying to accomplish with inclusion, and particularly with a group of individuals, our community that has historically not participated at any great rates in research. I also want to thank Andrea and Murtis for keeping me on task when I would forget to send them something, and making it very, very easy to travel to St. Louis. I'm excited about Mrs. Goodwin and the committee that has been working so hard over the years to assure that we are making progress with regard to inclusion. And then, of course, Mr. Norman Seay. I couldn't be more excited to chat with him and to be here today and to give this lecture with his namesake. He is certainly an inspiration to all of us, and he's certainly taken his life and sacrificed and made lemons out of lemonade everywhere he's been. So it's my great pleasure to be here today, and thank you all of you for coming to hear about some of the things that we've been doing at North Carolina A&T. As John said, I was actually went on sabbatical about almost 12 years ago and decided that I wanted my students to learn more about the Human Genome Project and how it impacted health and science. And I knew for sure that I wanted to do research in Alzheimer's disease because of family members who had struggled with this disease, and not only because of the disease itself, but also because of financial burdens and the stress that went along with it, and also just the lack of information and knowledge about Alzheimer's disease. Just not knowing how to get a good diagnosis and how to keep going when people are telling you, oh, you're just getting old, and it's just a normal part of aging. So I knew that this was something that I would be very, very interested in. And so we created a team of individuals at North Carolina A&T to assist us with this genetics project, and also with expanding what we do into communities across North Carolina to assure that people are getting the kinds of information that they need and the empowerment that they need to deal with this very, very burdensome disease. I just want to share with you that North Carolina A&T is now the largest HBCU in the country, with almost 11,000 students. We have Ph.D. programs primarily in engineering. We do not have a medical school. So what I'm going to tell you is that we are, in my college, I am responsible for about 3,500 students, mostly undergraduate and master's level students. And we have taken this project, the genetics project, and the outreach project, and really made them community projects and university projects. So I just wanted to share that with you before we get started. And John, will you just hold up your hand, because I did, as you told me, it took some slides out, but I probably still have 2 minutes, so just give me a little waiver when I need about 5 more minutes or 10 for questions. So I said that I would talk to you this afternoon about engaging community in the recruitment of African Americans for genetic studies in Alzheimer's disease. So I'm going to talk to you about how we got started and how generalization is not where it should be with science. And I promise you, it's afternoon, so I will not talk about genetics. I promise you I will not. And then how we were going about initiating a study of genetics in African Americans, and then more about some community outreach and engagement with the community, and then some best practices, some things that we learned, and then sustaining the community engagement. One of the things that we found out as we began to work with, to even conceptualize working in genetics, is that many of our funding agencies don't like to fund the outreach component as well as we need them. So it's really nice that President Obama signed into legislation the National Alzheimer's Project Act a couple of years ago, and there is funding there for some of this work. We got to get some of it, but there is funding there. So there's more funding now than there's ever been, particularly in the outreach arena. And of course, these are just some stats that most people in here are already very well aware of, that this disease, Alzheimer's, is the 6th leading cause of death. And more than 5 million people live with it. More than 15 million Americans provide unpaid care. So I'm going to talk to you a little bit about what we're doing with caregivers. These caregivers for Alzheimer's disease have an extraordinary burden of taking care of individuals, often for decades. And they are often people who are working, and I know there are caregivers in the room, so I won't bore you with that, the burden of this disease and what it's doing to not only the physical, mental, emotional, psychological, but also the physical aspects of the lives of people. So as was mentioned earlier, Adrian mentioned, I'm sorry. Oops. I told Ron I wasn't going to mess this up. This is a health disparity with, this disease is considered a health disparity, with more than twice more African Americans having Alzheimer's disease than whites, and more than 1.5 times in Hispanics than whites. So it's considered a health disparity. And less is known about Alzheimer's in diverse populations, as John was speaking about earlier. It is important for research centers and institutes to take the time to learn about how to engage communities of color, not just African Americans, but other communities, other races and ethnicities in research. I believe right now that the participation of African Americans is about 3 to 5% in clinical trials. And one of the things we say, that my group says when we're going out to communities, is that drugs are made for people who participate in studies. And that's about as basic as I can get it. But people understand that unless we are participating, again, not only African Americans, but underrepresented groups in general, unless we are participating in studies and clinical trials, then we're basically left out. And one of the things we also share is that we know people who have health issues with heart disease, and they take high blood pressure medicines. And 2 people in the same family really could take 2 different hypertension drugs. And so this is a very basic issue, but it is something that we have to remind people everywhere we go, particularly in doing our research studies, that it requires us to be active participants one way or the other. And we know that Alzheimer's disease, first-degree relatives are more likely to have Alzheimer's. We also know that it's the silent epidemic in the African American community. And it's not as silent as it used to be, though. We're very happy about that, and particularly as it relates to individuals talking more about it. People now will say, I'm a cancer survivor, very easily. And we want people to say, I know something about Alzheimer's disease, and I'm willing to go out and to get the information that I need to survive and to manage the disease with my loved one, or to participate or to be an advocate for getting policies changed around Alzheimer's disease. So as John said, a few years ago, I did sabbatical at Duke University and began working with some very powerful people in Alzheimer's genetics. And as we began thinking about understanding why African Americans might have Alzheimer's more than other groups, we thought, understanding the genetics of it might be a very important thing to do. So we began to do some feasibility work around how do we get African Americans to participate in studies. And then we began to collaborate with other institutions, particularly medical schools, these 3 in particular, and to answer these questions. Basically, why do African Americans get Alzheimer's, or why are they more affected by Alzheimer's at a disproportionate rate? And this was important for these reasons. The genetics of AD in African Americans is very, it's unclear with everybody, but particularly in African Americans. Of course, African Americans are underrepresented in the literature. We know that first-degree relatives, again, are more likely to get it, and the ApoE genotype is elusive in African Americans. So when we began doing this work, we decided to just look out there to see what was in the literature about Alzheimer's in African Americans. And as you can see from this slide, African Americans were very, this is about 11 years ago, very underrepresented in studies, genetic studies on AD. So we began to ask the African American community in the Greensboro area and across North Carolina about what it would take to get them into studies. We began to ask all kinds of questions. We designed a 4 to 6 item survey to assess people's readiness and some of the barriers and some of the challenges. What we found was something very interesting, that many African Americans had already participated in studies. Unlike what some of the perceptions that are out there, that African Americans will not participate. As a matter of fact, we went back and dug into the literature and found that there were other papers out there, even before we published ours, there were other papers that said, oh yes, African Americans will participate, but not as readily as some groups, and particularly if the recruitment process is not strategic and targeted. And so some folks had participated actually in more than one study, and approximately 2% in more than 3 research studies. And this was a random sample, I believe it was about 700 folks. We also did some work around literacy. I'm going to come back to that slide. But what we found is that as we were asking people about Alzheimer's of all colors and all races and ethnicities, that there was a low literacy level about Alzheimer's. People didn't even like to call it Alzheimer's. We found that people called it old-timers, alt-timers, senility, just a little senility, normal aging. Even the name of the disease was elusive to many people. We asked about certain drugs, and Aricept was the drug that most people's loved ones were taking, but folks were thinking they were getting cured. So I'm not going to go through the whole battery, but just some basic questions about Alzheimer's, which led us to our work around improving literacy. There's a big issue around stigma with this disease, and particularly in certain communities, and Alzheimer's in African Americans, that's one of the issues. One of I think it was the MetLife survey that says that people that losing their mind is right at the top of areas where people have the most stigma and the most fear about. So we knew that our order was pretty tall, and we had to remove some of these barriers for individuals and who we wanted to participate in studies. We knew that we had to build some long-term relationships, and we had to build some trust in the community. So this other challenge that we looked at when we began our work was in North Carolina, in the state of North Carolina. It wasn't a very friendly state with regard to what was happening at the state level in Alzheimer's disease. North Carolina is one of not only 9 states which does not have a state Alzheimer's plan. And yet it is growing, as most other states, in terms of the number of individuals who are 60 and above. So we had all kinds of challenges that we began to recognize as we began this work, but we knew that it was a tall order. We also knew that if we were going to do genetics work, that we were going to ask individuals to not only sit through, individuals who were already sick, individuals who had a distrust of medicine and science, and individuals who are caring for a loved one, most likely. We would get surrogate consent, which means that we were asking a daughter or a son or a spouse to provide consent for an individual to participate in a study that required at least 2 to 3 hours of assessments and then a blood draw. Well, going into a community that has a significant amount of mistrust, distrust, with good reason, and asking for even this, not the lumbar punctures that John is asking for, but to just get 6 tubes of blood was a tall order. And so we knew that we had to be very specific and really target our population. And we had to be strategic and we had to be honest. We had to go in with integrity. So our early aims involved a strategic recruitment plan, improving outreach and knowledge in the knowledge base of the target population, recruiting at least 2,000 African Americans initially. We were going to test the association of AD with the human genome, and that we don't have to worry about that today, refine the phenotype and seek molecular targets or long-term goals. But what was very important are those 3 in the top ones in the red. So we decided that it would be very important, and I hope you can see that in the back, but these are some of the kinds of things that we had to do. We decided that we were going to start with the community and we were going to end with the community. And that's basically what this slide is saying. As John said, I went to work with a group, a very powerful Alzheimer's research group at Duke. And this is what they had been able to do over a 10-year period and with open enrollment. As a matter of fact, the procedures and the recruitment processes that were being used were just open for everyone. So over a 10-year period, and Margaret knows that I present this. We did this for the Alzheimer's Association. So we looked at the data, and they had one of the largest banks in the country for doing genetics work, and only 46 individuals. I'm going to show you in a few minutes what we did in just a year and a half after we did our homework. So we wanted to, again, remove the barriers of minority participation in health-related research studies, and particularly genetic studies in Alzheimer's disease. So we asked individuals at different ages, and we've done a number of intergenerational studies because of who we are at North Carolina A&T State University. And we looked at individuals' willingness to participate in our studies. And again, over 50% of these individuals in each of the groups said that they would be willing to participate in a research study. Then we looked at, as the age increases, the number of persons who actually participate also increases. Well, that makes sense because they're getting older and they're smarter. I tell my kids their brains don't really develop fully until they're 25. So, we get smarter as we get older. So we did an age correlation there. And of course, we looked at the kinds of studies that individuals would be willing to participate in. Of course, surveys were the top choice. But if you notice, people are willing to participate in all kinds of research studies. We looked at, and I apologize, that one, can't see the numbers there, but that's a very high one, motivation for participation in research studies. And relative with the disease is very, very important. And in Alzheimer's disease, as we said, first-degree relatives have a higher chance of getting Alzheimer's disease. So many people that we talked about said, I don't want my child to suffer with this disease. And that was actually our top. Of course, if I have the disease, if they were early on. And we actually looked at monetary compensation. That was important to some people. And of course, many looked at this as their civic duty. Again, this is how the kinds of studies shook out. And these are the numbers that you actually couldn't see on the previous slide. So we actually looked at just a battery of questions that we went into the community and we asked individuals, what would it take? What are some of the barriers? What do you need in order to get to feel confident that we are doing what you need for us to do with this study? The point I make here is that before we begin to get blood as researchers, there is work to be done. There is the education, there is the outreach, there is establishing trust in the communities. And what we find is that if we do that on the front end, it saves a lot of time on the back end. Let's see. So one of the issues that we dealt with, and this is another paper that we put out, one of the issues that we dealt with was individuals were concerned that people were going to come in, get their tests, get their blood, and there would be no relationship. So this paper talks about the importance of having an ongoing relationship of some type. Well, some might ask, well, how will I do that? I only have a certain amount of money, I only have a grant for a certain amount of time, and the agency may or may not like it if I spend a lot of time and money and effort in this area, and if I do, I can't get to the bench. So I just point out, though, that there are ways, and I'm going to give you some examples in a minute, that there are ways to continue to engage the community even after the study is done. I just read Horizon, the newsletter from the ADRC, and that's one way. People enjoy getting our newsletter. They enjoy getting updates on what is happening, not only with the particular study in which they are participating, but in terms of Alzheimer's research in general. When people are feeling hopeless about this disease for which there is no cure and there is no drug that really slows the disease, they want to know some science. So it is up to us to give it to them in a way that they can understand it. But that was one of the things that came out in one of our studies. Some other things in terms of strategies was that we started, that's me in the middle. That was when I was young. And so we began with just three individuals in terms of our outreach. We did quite a bit of training them and making sure they knew the work. They knew Alzheimer's back and forward. And getting people who looked like the target population. So our staff was very, very professional. They had inroads into the communities. One of these persons worked in the community for a long time. The other one was actually a master's student who knew the community, but they had to get the training. So one of the things that we stress when we go out into the community is that we need to know what we're talking about. So they had to go through quite a bit of training. We also decided that we would begin our studies with some compensation. So we give our patients a small gift. We give them a $50 gift card. We actually now have an external private person who pays for that for us. We have to work collaboratively with the community we be affected, and we have to do some things that are culturally sensitive. So this is the table that I was showing you just after I showed you the one where we only had 40-some participants in an open enrollment, and just after a year and a half where we did some of the things that I just talked about, our enrollment increased from that 40 to 178. And so the point is, even with a small staff of individuals going out into the community, when we were intentional about making sure that our community resonated with what we were doing, they understood what we were doing, even from the consent process, which can be convoluted and difficult, but taking the time to meeting with them in their homes. Actually, we went to their homes to meet with them. They didn't have to come to campus. We have a space on campus for them, but we actually went to their homes to do that. So, in summary for this section, engaging the community in Alzheimer's education and research is of mutual benefit. It benefits the research, but it benefits the community if the education and outreach are done well. One of the other things that we shared with our medical schools are the kinds of strategies that we use, and we all had really good retention rates. Our folks didn't drop out. Once they said they were going to participate in our studies, they actually participated and did not drop out. So, in summary of what we found, there's a great need for outreach, increased education and literacy, and not only in African Americans, because we've begun to do some outreach with our Hispanic community, and all communities need this education. African Americans have distrust of medicine and research, yes, to some extent. It's getting better. It is getting better. But they want to understand what is happening. They want to understand where their blood is going, where their samples are going. They want to make sure it doesn't end up downtown. And so that is, we see that as an expectation, and we see that as a necessity. Our study population wanted to continue with the connection even after the research process is over, so we've done a number of things I'm going to share just quickly in a few minutes. Reciprocity is important to our group. They want to know that they are contributing, but we are contributing to their success as well. And they do care about research and medicine and future generations. And they will participate in research studies, and that's very, very key. So that perception that African Americans will not participate is indeed flawed. The other thing that we found out from our studies is that African Americans were very interested in the caregiving piece of managing the disease. And so we've done some, these are just some other things that we found out, and of course these are very obvious and you know them already. But support for caregivers, again, is really one of their top priorities when we asked African Americans who participated in our studies and those who come to our Caregivers Conferences, what are some of the things that you really need most support with? And support for caregivers ranks very high on that list. Of course, their mental, physical health, again, family finances, support groups, adult daycare, all of those things are important. And what we find is that often they are offered in some way, but often they're in ways that people don't know how to access, where people do not know how to access the resources. One of the big things that came out of our work with caregivers is a support group. There was not a support group in Greensboro, and Greensboro, I think, is the 4th largest city in North Carolina, and there was not a support group where African Americans attended. There were some support groups in Greensboro, but because of the work that we had done with caregivers and their request to create one, we created a support group right there on campus. And I was surprised when we found out that there were employees there, irrespective of the idea about stigma and not wanting people to know. Employees came, students came to our support group. And it's a really robust support group, and it's held on campus once a month. So again, we raised a lot of awareness. We went through our journalism and mass communications department, and this is just one article that was in the diverse issues in higher education. So we even use higher education journals and magazines to write in. We use newspaper. A&T has a newspaper, it has a radio show, it has a TV show. So we use these mediums to engage people in Alzheimer's education. And so our messages, which were very scripted sometimes, and then other times we would bring in experts, would go across the state of North Carolina, throughout the listenership, where African Americans actually listened. We are in the process now of doing a radio campaign where people will get Alzheimer's messages on Sunday morning before they go to church. So we had to become experts in knowing when do people listen to the radio, and what kinds of newspapers will people read, what kinds of television shows will people watch. We also have a Facebook page. We use social media. And folks like to dress up. So you see galas there. So we've had Alzheimer's galas, and I'll share that with you in a few minutes. Of course, we participate with the Alzheimer's Association in walks, specialty days, faith-based health moments. And one of the things we found out was that you don't just walk into a Black Baptist church and ask the pastor for 5-10 minutes on Sunday morning. But we did. We were able to do that. The word got around, and now we're able to do that quite frequently. So our Caregivers Conference, our annual Caregivers Conference is actually coming up in just a few weeks. This past one, last year, these are the counties that inquired about our Caregivers Conference. 6 folks from 16 different counties in North Carolina attended our Caregivers Conference. We went from about 25, 30 people a few years ago, I'm not going to worry about that one, to now our conferences are about 350 to 400 people annually. And so the word is out that there's work at A&T, and now instead of our having to go out and do a lot of seeking folks are calling us. We like that. And so this is just some data that I will breeze through. But the point here is that with everything that we do, there's some piece of data that we get from it. We ask people, did this work? What do you need? And again, out of our Caregivers Conference came our support group. So we're trying to provide some opportunities for individuals. And we find some very interesting things when we ask people, how do you find out about information about Alzheimer's disease? And as you can see, 27% of folks say they don't receive information at all. This data came from our Caregivers Conference. So these are people who are actually taking care of people with Alzheimer's disease. And yet they are saying that to a great extent they don't get information about Alzheimer's disease. And of course, the ncatad.com is our website. So many of the people do visit our website. One of the areas that's very important for the Alzheimer's Association as well as AARP is this lack of ability to make money when you're caring for a person with Alzheimer's, or reduced ability to make money. Many of our caregivers are working in addition to caring for that loved one, and many, of course, are also caring for a child. So they're in that sandwich generation. This is a very important piece. And the question becomes, what do you do after you've spent 25 years taking care of a loved one with Alzheimer's? And many, of course, are choosing to stay at home now as opposed to going directly into a long-term care facility. What do you do with yourself after you've done that? And how do you get back into the workforce? Or do you have the physical, mental, emotional capacity to do so? So that's a big area that we're looking at now. The financial piece is huge in terms of preparing for a family who's preparing a family for these years living with a person with Alzheimer's disease. Many people don't even have wills or trusts, or don't understand what kind of financial support will be needed. Some individuals are paying $70,000 to $100,000 a year just to care for a loved one who is in a long-term care facility, and we know that we have to get way, way, way down before we can get some support. So just providing education in this area is something that we've begun to work with our financial planners in Greensboro to support families. And then the long-term planning for themselves is another big issue. So why are we doing all of this when we're talking about genetics? And the question is, these are the issues that people who are burdened with Alzheimer's are saying these are the kinds of things that they need. Will A&T be able to accomplish all of this? No. But we can certainly connect them with the right people. So we created this Keeping Memories Alive goal to significantly increase awareness and participatory action in Alzheimer's disease among diverse populations. Again, our initial genetic study was about Alzheimer's in African Americans, but we are moving toward assisting other populations in understanding this disease, the burden of management, and how folks can get care and the resources they need to support. So we want to improve education and awareness with grassroots efforts as well as collaborations with multiple media outlets, improve motivation of individuals to take tangible steps and actions against Alzheimer's. We've actually partnered with one of our legislators to support us in the advocacy work in North Carolina to create that state health plan. And we are actually making some tiny steps toward that. And so we say to individuals that there are many ways to participate. Participating in a study or clinical trial are important, but there are other ways to bring awareness to this disease. And of course, finally, with Keeping Memories Alive project is to help individuals understand that it's really up to each of us to make sure we're living as healthy a life as we possibly can. So I'm just going to give you now, just breeze through some of the activities that we've done with our Keeping Memories Alive project. Again, we have an annual gala where we invite folks who are caregivers, folks who have been diagnosed early, folks who are advocates and we do this either in Greensboro or in Charlotte, which is our largest city, and we invite people to come and enjoy an evening of entertainment and information. So all of our activities are information-based, so whether we're having a gala or we're having a support group, it's information-based, it's education-based. This one was an interesting, this is one of our state legislators, and in the middle there on the left is Idol winner Ruben Studdard. Ruben Studdard wrote a song for us. It's absolutely beautiful, and we're going to have a launch probably in the spring. We want all of you to download it. We'll let you know. But he wrote a song. It's called I Know It's You, and it's based on an Alzheimer's patient interacting with a caregiver or a child. And of course, we even with our galas, again, we collect information and collect data to help us to guide our actions with outreach and education. One of the most exciting things that we've done in just the last few months is to get approval for a university-approved Center for Outreach in Alzheimer's, Aging, and Community Health, and we call that COACH. And so with a major gift from Merck, because of the outreach work that we were doing, and they wanted us to do more. They wanted us to provide outreach, to educate, improve literacy, and encourage individuals to participate in studies and clinical trials. We do not have a trial with Merck. We do not have bench research with Merck, but they have. But with this gift, we were able to open this center, and it is a university-approved center, and we're very excited about it. The ribbon cutting is November 21st, and any of you can come if you like. So with that, we will increase interdisciplinary research and engagement, improve our partnerships, increase formal and informal education, increase advocacy, and increase the participation in research and clinical trials by underrepresented groups. And of course, we will encourage healthy aging. So our ribbon cutting is the 21st. And that's a big building there. We only have a piece of the building. I have to make that disclosure. And but we're really excited. We'll have specialty rooms, assessment rooms, and education rooms, and a community-based room, as well as some office spaces. And so we're very, very excited about that. Just some other things that we participate in to raise awareness. This is Purple Sunday, and many of you have probably heard of that, where we ask churches to have a Purple Day to raise awareness. And this year we're going to have a Purple Saturday. A&T has an award-winning marching band, and they will have, like they do for the cancer folks, they will have the purple plumes and shoes and flags and all that stuff. We'll be on the Jumbotron talking about Alzheimer's disease. Of course, we do the walks. And as Dean of the College of Arts and Sciences, where I have 13 departments working with us, now again people are coming to us and coming to the center and asking how they can get involved with the Alzheimer's work. I do not require them to do that. They do it on their own. It does not go into their annual report, their annual evaluation, but they're interested in it. And so these are the departments that have already become interested in the Alzheimer's work within the College of Arts and Sciences, and we do have 2 projects in technology and 1 in engineering. And so my point here is that it has become a buzz in the A&T community, and we're very, very excited about that. We believe that these projects will grow. A couple of these are already funded externally, and so we're very, very excited about this learning community in the College of Arts and Sciences. I will stop there just to say that this is a major collaboration, and again, I did not touch the genetics, but there's plenty of that to talk about. I just wanted to share with you some of the community-based work that we're doing, some of the learning communities that we are involved in, and the excitement that we have at North Carolina A&T State University with regard to improving outreach and education and encouraging individuals to participate in studies and clinical trials. It is only through that we will find the level of inclusion that the NIH talked about in the Revitalization Act back in 1993 that we've sort of ignored. Thank you all very much.